Hi everyone, I'm Dr. Pavan Chebbi from Apollo Spectra Hospital, Bangalore, here at Kodamangala. I'm a consultant orthopedic surgeon over here with special interest in sports medicine, sports injuries, arthroscopy, joint replacement, and deformity correction. So today, I've got a very interesting topic and very commonly encountered subject, which is very common among sportsmen, especially runners. That is Shin Splints, also called as Medial Tibial Stress Syndrome. So this condition is very commonly encountered among athletes, especially runners, dancers, and newly recruited members of our military, police, or anything which requires a lot of physical endurance as a trainee. So, shin splints. What is shin splints or medial tibial stress syndrome? It is a condition in which the front of the leg, that is, if this is the knee joint, the front of the leg, the inner aspect of the front of the leg is painful, usually during or after a physical endurance activity, mostly running. It could be because of sometimes because of cycling also. It can be because of dancing also, or training. That is physical training as well. So this continuous pain in the front of the leg at the inner aspect, which increases, decreases, which can be a sharp shooting pain, it can be a throbbing pain, or it can also be a dull aching pain, which can be constant. Usually after sporting activity is called as shin splints. So, what are the causes of this condition? What causes shin splints? This particular area is completely bare. If you see, the outer aspect of the leg is completely covered with a muscle mass, but the inner aspect, you have a bare bone next to the skin. So here you have the skin, then you have something called as the periosteum, that is the covering of the bone, and then you get the bone itself. So the periosteum or the covering of the bone is very close to the skin at that particular area, and it's pretty much bare. It's pretty much bare to the skin. So this area, if there is overusage, if there is no proper stretching which is being done, and if a person gets involved in constant running at very quick sessions, he increases his ability to run, increases his distance to run, or runs on an uphill, then what happens is that person might get into this particular condition called as shin splints. So here, the periosteum, that is the covering of the bone, is markedly inflamed. It is swollen. So it can show as a swelling. It can show as marked pain. Can also show as some changes, in the particular way the person walks. He might not be that comfortable walking. It might just be a generalized pain, but mostly it is very much localized to that particular area itself. So when a person gets this particular condition of shin splints or medial tibial stress syndrome, it can be confusing. It can be associated with a lot of other things which may be the causing factor for this. Most simply, if a person is anatomically perfect, he doesn't have any other deformities or any other medical condition or musculoskeletal condition, it can be the cause of this can be just overusage, increasing the number of miles or kilometers you run, increasing the intensity of the run, etc. The second cause can be improper footwear. If the sportswear, especially the footwear, is worn out, if the sportswear or the footwear doesn't have a proper arch or is not ergonomically made, then what happens is a person, even though he is anatomically perfect, he or she can develop shin splints. Then we have people with obvious deformities. That is most commonly is the flat foot. I'm sure everybody know about flat foot. When the arch, the inner aspect of the foot, the arch when it is missing or when it is not well formed, can precipitate to people who run to have this shin splints. Also, a rigid arch can also be one of the problem. A rigid arch in which it is formed nonetheless, but it is too rigid. It doesn't, it's not too flexible when a person performs or runs. That can also cause shin splints. Um, Other than that, other deformities, something higher up, maybe a muscle weakness, maybe some sort of a deficiency, either vitamin D, vitamin B12. These are essential connective tissue vitamins. If they are deficient, can precipitate to shin splints. So now we know what shin splints are. What do we do about it? How do we treat it? Basically, shin splints is a very commonly encountered condition. It can be very easily treatable, but can be quite frustrating to runners, sportsmen. So here, what happens is, if a person has got shin splints, most common treatment we give is icing, ice packs just after the sports, NSAIDs, that is your anti-inflammatory medication. Usually, very basic anti-inflammatory medication do the trick. You don't need to give high dose of anti-inflammatory medication. Next will be to do a good amount of stretching after the particular running sessions. Then we make sure that the person is well evaluated to see if he or she has got a vitamin deficiency, maybe vitamin D or vitamin B12, or if he or she is being hydrated well, because hydration plays a very important role, because lactic acidosis can also precipitate to shin splints. So we need to see whether the hydration is good or not. And finally, make sure that the person wears a proper footwear. Make sure that they do enough amount of stretching, enough amount of warm up before and after the exercise. And then make sure that the person, if he or she is symptomatic, at least 2 weeks of rest to avoid getting a repeat attack of shin splints again. Then we have certain other treatments, surgical treatments in case of resistant type of shin splints, or people with something which they have tried all means and they don't have any relief because of that. So what we do is, surgically we do something called as a deep posterior fasciotomy. That is the back of the thigh, the deep posterior fascia is released, so that it releases the tension and we don't get too much tension on the front of the knee joint, and it can prevent a person and help him to get her to go back to sports without any problems of having this shin splints later. And also, some people also prefer to do a periosteal release, which is a too far fetched, but then that is also a way of treatment for this. However, there's always prevention is better than cure. So shin splints can very easily be prevented. Of course, before going into prevention, we need to know what are the differential diagnoses of shin splints. So there are other conditions also which can mimic shin splints. It could be an entrapment neuropathy, it could be an arterial condition. Sometimes varicose veins can cause similar type of pains in that particular area. Most commonly, we orthopedicians, we have stress fractures, especially in the this junction, that is the proximal and middle junction, especially in military recruits and people have started running newly. They have a stress fracture at condyles, that is at the knee joint, or somewhere here at these two junction. So we need to rule out with an X-ray whether there is a stress fracture or no. And of course, we can get aids by MRI or bone scan if necessary. If we don't get any idea in the X-ray, we can get some X-rays and we can get some bone scans and MRI scans as well. So after having made a proper diagnosis of shin splints, prevention is, first of all, to make sure that the person keeps away from running for at least 2 weeks. It's not that they have to stop running, but then they have to keep away from running for at least 2 weeks. So here what happens is, give proper amount of rest. Doesn't mean that you need bed rest. You can get into other activities to keep yourself fit. Most importantly and most useful has been swimming. Swimming, walking in the pool is an excellent exercise for the lower limbs, and it can definitely help in people who have medial tibial stress syndrome. So Apart from swimming, you have stationary cycles, you have uh, elliptical cross trainers, not treadmills because it can mimic a walk or a run and it can exaggerate the shin splint again. So these can be started to keep one's a little more active. Other than that, also I would like to recommend people who are only into cardio, only into running, to balance their fitness regime by getting involved in a little bit of weight training. Not much, but then little bit, just so that the muscle mass is maintained. There is no muscle loss, which usually happens because of only because of cardio. So make sure that you do some weight training as well during this time when you're taking rest, or in any way you can inculcate this into your daily fitness regime. So this makes sure that the bulk of the muscle is well maintained, you get enough rest, and then following that, you can go back to your sporting activity or especially running. And finally, change in the footwear. So footwear is absolutely important in preventing shin splints. So people who have a worn out footwear, who have arch problem, we need to go and get a proper evaluation of their foot done to get a proper size of the footwear which they are using, a footwear which is more ergonomically made, which is, maybe you may have to spend a little more, but then better prevention is better than cure. So as much as possible, you need to make sure that the footwear is good, ergonomically made, and you are comfortable using it. And also recently we have come across some suggestions, or there are some talks about barefoot running. I'm sure you must have, a few of you must have heard about this. So barefoot running is known to be causing a lot of advantage in getting up a person's lower limb muscle training back. It can also it can prevent shin splits to a great extent. And of course, there is no scientific evidence for this, that barefoot running can help in prevention of shin splits, especially, but then it has its own advantages. So it is something which we can try and maybe we need a little more study, but if you have the necessity conditions, you can try and do some barefoot running. So this is what my talk is about shin splits, also called as medial tibial stress syndrome. And a very simple condition, can be irritating, can make a person lose interest in running, sports, etc. But then very easily treatable and very easily preventable. Thank you.